In this video, we'll discuss about Helicobacter pylori. Morphology, it is a gram-negative spiral rod. Gram-negative spiral bacilli. This is the gram-negative spiral rod which has lophotrichus. That is unipolar tuft of flagella situated at one end of flagellae. So this is motile with the help of unipolar tuft of lophotrichus flagella. It grows on chocolate agar medium or campylobacter medium. These helicobacter grow on chocolate agar or campylobacter media under microaerophilic condition. It shows catalase positive and oxidase positives. Both tests are positive. So this one is the gram-negative spiral rod. It have lophotrichus, punja flagellum at one end. Then it grown on chocolate agar medium and campylobacter medium under microaerobic condition. Catalase and oxidase test positive. Distinctive features about H. pylori. This H. pylori is production of abundant urease. Production of abundant urease which is used for the rapid urease test. The only source in H. pylori in human is gastric mucus. So the only source of H. pylori in human is gastric mucus. Next one is pathogenicity. The H. pylori causes mild acute gastritis on few person. Okay, it causes mild acute gastritis on few person, which may last for about 2 weeks. So it causes acute gastritis for few person which may last for about 2 weeks. In some people, the infection is transient. Some people, this infection transient and mostly persist for years. In such patient, they are usually asymptomatic. Okay, some people, this infection is transient, mostly persist for years, asymptomatic usually. So important things to notice: the bacterium is present only overlying mucus. Only present overlying mucus. It is not invade that mucosa, not invade mucosa. So this gives production from acidic pH of stomach. So this gives production from acidic pH of stomach, and the most common site of H. pylori invasion in gastric antrum. Invasion in gastric antrum. The bacterial protease, toxins and ammonia which is released by urease activity and autoimmune response to gastric antigens. So the bacterial protease, toxin, ammonia which is released by urease activity and autoimmune response to gastric antigen. All these contribute to the development of disease caused by H. pylori. In some atrophic gastritis, gastritis, may be seen in last stage. The H. pylori infection is risk for development of gastric malignancy like adenocarcinoma and maltoma. Maltoma regress after elimination of H. pylori by treatment. H. pylori by treatment. This one, that chronic atrophic gastritis may be seen in later stage. The H. pylori infection risk for the development of gastric malignancies like adenocarcinoma, maltoma. This maltoma regress after elimination of H. pylori by the treatment. Next, virulence of H. pylori. The virulence associated with CAG, which is cytotoxin associated gene, CAG gene. Then VAC, vacuolating cytotoxic gene. Then urease production and motility of H. pylori. The virulence factor of H. pylori associated with the CAG, cytotoxin associated gene, then VAC, vacuolating cytotoxic gene, then urease production and motility of H. pylori. Next one is laboratory diagnosis of H. pylori. This is done by two type of test. Invasive test and non-invasive test. First we want to discuss invasive. Here endoscopic biopsy of gastric mucosa is taken. Here endoscopic biopsy of gastric mucosa is taken, which is secreted into two component. One piece of biopsy is put into urease indicator medium, which gives positive result within few minutes. Second part of biopsy is used for microscopy and culture. Under microscopy, it stain using silver stain or gram staining method, which shows spiral bacilli. So that biopsy, second part of biopsy used for microscopy and culture. Under microscope, we are using silver staining and gram staining method, which shows spiral bacilli. Then culture is the more sensitive. Here we are using enriched medium or used for culturing. Here chocolate agar medium, Campylobacter medium we are using. So invasive method, two part. PISA biopsy for urease indicator medium we are using, positive result within few minutes. Then microscopic, then culture, enriched medium, chocolate agar medium, H. pylori medium we are using, Campylobacter medium. Chocolate agar and Campylobacter medium. Next, coming to a non-invasive test. In this non-invasive method include that serological technique by ELISA, enzyme linked immunosorbent assay, and urease breath test. This is the sensitive and reliable technique. Urease breath test, the person drink carbon labeled urea solution. Person drink carbon labeled urea solution and detect in breath. Last, treatment of H. pylori. This H. pylori is sensitive to several antibiotics and bismuth salt. Sensitive to several antibiotic and bismuth salt. Standard treatment include that combination of bismuth subsalicylate, bismuth subsalicylate along with tetracycline or amoxicillin along with metronidazole. This triple therapy given for 2 weeks. What are the things? Bismuth subsalicylate along with tetracycline or amoxicillin or along with metronidazole. Three drugs, triple drugs together given for 2 weeks. Then alternative scheme treatment of H. pylori. Alternative treatment combination of proton pump inhibitor like omeprazole, then clathromycin, omeprazole and clathromycin. Then drugs resistance and recurrence of H. pylori is very frequent. Drug resistant and recurrence of H. pylori is very frequent. This is all about H. pylori. Thanks for watching.